Hello friends, welcome back to Complete Medical Coding. Today I am here with some important mock questions. Okay, this consists of both CPT and ICD as well. So some important mock questions, let's discuss it today, and hope my videos are useful. So if you find my videos useful, please share it among your friends. Please share my channel. Those who are new, please subscribe. Please support me. Okay. So let's move to the questions one by one. Let's move to the first question. Operative report. This is actually a case question. You will get 10 questions in your examination as case questions. Okay, case studies. 10 questions from each chapter. I mean, one question from each chapter. So total will be 10 questions, 10 case studies. So you have to be careful while reading such type of questions. But it will take some time to make the question, to make you understand the question. But finding answer will be, of course, it will be easy, but few options will look the same. So from that you have to identify the exact answer. Anyway, let's go to the question. Operative report. Pre-operative diagnosis, atrial fibrillation. So this is a pre-operative diagnosis. Okay, this is not a confirmed diagnosis. This is a pre-operative diagnosis. What the doctor has assessed before doing the procedure. Now, operation, direct current cardioversion. That is a procedure doing here. Direct current cardioversion. Now, let's see what procedure, how the procedure is being carried out. Procedure. After obtaining informed consent, a direct current cardioversion was performed. The patient was given sedation by anesthesiologist. A 120 joule of synchronized shock was delivered, but atrial fibrillation appeared to persist after a few sinus beats. A 200 joule of synchronized biphasic shock was delivered. Once again, sinus rhythm was restored, but only for 50 seconds. Then, a second 200 joule of synchronized biphasic shock was delivered, and this time sinus rhythm was restored and persisted. So that's the procedure. Now conclusion. Successful direct current cardioversion after a few attempts with restoration of normal sinus rhythm. What codes are reported? So conclusion and post-operative diagnosis. Conclusion, that's similar to post-operative diagnosis. What is the diagnosis done? The confirmed diagnosis. What's the diagnosis done after the procedure? Which is that you need to code. You need to code it. Okay. So what is the conclusion? Same. It's the same as the pre-operative diagnosis. Conclusion. Yeah. What is the outcome of the procedure? Okay. Successful direct current cardioversion. The procedure is successful. That is what it means. Okay. Successful direct current cardioversion after a few attempts with restoration of normal sinus rhythm. Now you have to find, you have to mark the codes. What codes are reported here? So let's find out what it is. What is the first CPT code? Okay, if you can see the options, the first one 92960. I'm just going with the CPT now. 92960, 92961, 92971 and 92950. Let's find out what CPT it is. If it is, you can either find out CPT code first or you can find out the ICD code also first. It depends on you. Okay. Anyway, let's find out the CPT. If the CPT code is only one, it's okay to find initially. You can find whatever you want. But if there are more CPT codes and only one diagnosis, directly go with the diagnosis. So from that you can skip out those unwanted options. Okay, like that you can save the time. So first one, what is 92960? Let's go on with the CPT codes now. 92960. Cardioversion elective, this comes in 90,000 series. Okay, medicine chapter, medicine. Cardioversion elective, electrical conversion of arrhythmia, external. This is external cardioversion. Yes, external cardioversion. It is written external, right, in the question. Operation, direct current cardioversion. Yeah, it is nothing mentioned external, but it's fine. Direct current cardioversion. Now, what is 92961? Same cardioversion, elective electrical conversion of arrhythmia, internal, which is a separate procedure. Direct current cardioversion, here internal is separate procedure. What is 92971? Cardio assist method of circulatory assist, external. Cardio assist method. No, that's a wrong code. Cardio assist method of circulatory arrest is a it is not the CPT that we want. And what is 92950? Cardiopulmonary resuscitation. No, this is also not cardiopulmonary resuscitation. This is what which belongs to CPT codes 92960 and 961. Cardioversion, same. Cardioversion, elective electrical conversion of arrhythmia. So you have to find out whether it is external or internal. How can you find out whether it is external or internal? Let's read the question once again. Direct current conversion procedure. After obtaining informed consent, a direct current conversion was performed. The patient was given sedation by anesthesiologist. 120 joule of synchronized shock was delivered, but atrial fibrillation appeared to persist after a few sinus beats. Again, 200 joule of synchronized biphasic shock was delivered. Once again, sinus rhythm was restored, but only for 50 seconds. Then a second 200 joule of synchronized biphasic shock was delivered, and this time sinus rhythm was restored and persisted. Successful direct current cardioversion after a few attempts with restoration of normal sinus rhythm. So here in the CPT code 92961, which is mentioned, cardioversion, elective, electrical conversion of arrhythmia, internal, separate procedure. If the cardioversion current, if the cardioversion procedure is carried out in a separate procedure, some other procedure name. Okay, if it is carried out in a separate procedure, it means it is an internal code. And since here there is nothing mentioned a separate procedure, it is carried out along with the whatever the procedure is being carried out. There is nothing. I mean, there is no additional procedure. Only one procedure is carried out. There is no additional. There is no extra. I mean, there is no a separate procedure which is being carried out here. Okay, nothing mentioned about some additional procedure. So it means this is an external procedure. So our correct code will be 92960. Correct CPT code will be 92960. Okay, since there is no separate procedure carried out, or since there is no additional procedure carried out, you can't code for the internal one. You have to go always for the external one. If it mentions something about some additional procedure carried out to maintain this and all, if in the question if it is like that, then you can definitely go to the internal code 92961. Since nothing like that is mentioned here, the answer will be CPT code 92960. Okay, and anyway, let's go to that ICD also. Since you got the answer, still we'll just look what is that ICD code. I48.91. I48.91. Yeah. What is I48.91? You can open your ICD code book. It's written I48.91. That is unspecified atrial fibrillation. Same. That is the diagnosis, preoperative and postoperative diagnosis, atrial fibrillation. Okay, it's the same only. If there is any difference, definitely they will mark as a separate postoperative diagnosis. If there is, sometimes in some question, both will be mentioned. Preoperative, postoperative, both will be mentioned. Both can be the same. And sometimes both varies also. Okay, if there is nothing mentioned and only conclusion is mentioned, so from that you have to identify whether the preoperative diagnosis and postoperative diagnosis are same or not. Here there is nothing, no procedure failed or nothing has mentioned. So it means it's the same. Preoperative and postoperative diagnosis are the same here. Okay. So answer is here option A 92960 for the cardioversion procedure external, and then I48.91 atrial fibrillation code. Okay. Now moving to the second question. A patient with chronic renal failure is in the hospital being evaluated by his endocrinologist after just placing a catheter into the peritoneal cavity for dialysis. The physician is evaluating the dwell time and running fluid out of the cavity to make sure the volume of dialysate and the concentration of electrolytes and the glucose are correctly prescribed for this patient. What code should be reported for this service? So here you have, this is again 90,000 series medicine chapter. Okay, here you have to code for the dialysis code. Dialysis. So here patient is with chronic renal failure. Sometimes they will add the diagnosis also. Here in the question it's only, you have to find out only the CPT code. Sometimes they will ask for the diagnosis as well. What will be the diagnosis here? Chronic renal failure. Chronic renal failure. Okay. So now let's find out the CPT code here. So what's the procedure carried out here? The patient is in the hospital for dialysis. Okay. After just placing a catheter into the peritoneal cavity, yeah, dialysis. The physician is evaluating the dwell time and running fluid out of the cavity to make sure the volume of the dialysate and the concentrate of electrolytes and glucose are correctly prescribed. That's just the procedure. Okay. So let's go to the code directly. What is 90935? What are the codes here? 90935, 90937, 90947 and 90945. Let's move to the options. First one, 90935. 90935 represents hemodialysis procedure with single evaluation by a physician or other qualified healthcare professional. Okay. Hemodialysis. What is 90937? Again, hemodialysis procedure requiring repeated evaluation with or without substantial revision of dialysis prescription. Now, what is 90947? Dialysis procedure other than hemodialysis. Example, peritoneal dialysis, hemofiltration or other continuous renal replacement therapies requiring repeated evaluations by a physician or other other qualified healthcare professional with or without substantial revision of dialysis prescription. So this is dialysis other than hemodialysis, means what type of dialysis is mentioned here in the question, that you have to find out initially. What is in the first sentence? A patient with chronic renal failure is in the hospital being evaluated by his endocrinologist after just placing a catheter into the peritoneal cavity for dialysis. So, placing a catheter into the peritoneal cavity, that is a procedure that the physician has carried out here. So, which means this is a peritoneal dialysis. Okay, that's why it is mentioned, marked in the bracket, peritoneal dialysis. So, for peritoneal dialysis, you have to use the codes either 90947 or 90945. Now, let's check what is 90945. Dialysis procedure other than hemodialysis. Again, same. Example, peritoneal dialysis, hemofiltration or other continuous renal replacement therapies with single evaluation by a physician or other qualified healthcare professional. So, 90945 is single evaluation and 90947 is multiple evaluation. Okay, repeated evaluation. Here, there is nothing mentioned about any repeated evaluation, which means default you have to mark for the single evaluation by a physician. Okay, if in the question nothing mentioned about multiple evaluation, repeated evaluation, then it means it's a single evaluation. So here our answer will be option D, 90945. Dialysis procedure, okay, with single evaluation by a physician or other qualified healthcare professional, because here it's mentioned the physician is evaluating the dwell time and running fluid, which is a single evaluation. They didn't repeat it again. So, single evaluation code you have to mark. So, 90945 is the answer. Okay, hope you understand. Now, let's move to the third question. A new patient presents to the ophthalmologist with a complaint of visual disturbances and decreased vision for 1 month. He has blind spots in his peripheral visual field. A comprehensive medical eye examination is performed. In addition to fundus photography and an extended visual field examination. So, from this sentence, you have to find out what are the procedures carried out. Fundus photo, see, it is mentioned, comprehensive medical eye examination is performed. So, that procedure you have to code. Okay, in addition to fundus photography. So in addition to fundus photography, so fundus photography you have to code, and an external visual field examination. So extended visual field examination also you have to code. So 3 procedures are carried out here. Okay, so you have to code for all these three procedure: comprehensive examination, fundus photography, and extended visual field examination. Okay, so like that you have to pick out how many procedures, what are the services procedure codes you have to code like. Now let's find out what is the diagnosis here. The interpretation and report are in the medical record. Final diagnosis, DX represents diagnosis. Okay, final diagnosis is primary open angle glaucoma, mild stage in both eyes. So it's directly written here. What is the final diagnosis? So it will be easy for you to find out the diagnosis. Okay, final diagnosis is primary open angle glaucoma, mild stage in both eyes. What CPT and ICD codes are reported? So here, since it's written directly, the final diagnosis, what is the final diagnosis? So you can first go for the ICD code, and also ICD code it's easy to find, right? Because there are 3 procedure codes that you have to find out. So you can first directly you can find what is the ICD code. So let's find out the ICD code for primary open angle glaucoma, mild stage, both eyes. So what is the first diagnosis? H40.1131. What is H40.1131? You can open H code in ICD code book. H40.1131. H40.1131 represents primary open angle glaucoma, bilateral mild stage. Yes, bilateral means both eyes. This is what we need. Primary open angle glaucoma, mild stage, both eyes, bilateral. Okay. Still, we will just check what is the other one. What is H40.1111? Primary open angle glaucoma, right eye, mild stage. This is only right eye, and H40.1121 represents left eye. Primary open angle glaucoma, left eye, mild stage. So you got the correct ICD code as H40.1131. If you can see options B and C, how they have marked, even that option is also correct. If you can check, even that ICD codes, what they mentioned is also correct. H40.1111 is primary open angle glaucoma of right eye, and H40.1121 is left eye. But since there is a combined code as bilateral, you can't go for options B and C. You can't code like right eye separately, left eye separately. You should not code like that, since there is a bilateral code. Okay, so that is why H40.1131 code is the correct code here. So which is there in options A and D only. A and D, H40.1131. So you can directly skip options B and C. Even though that ICD codes are correct, but they have marked it separately, left and right separately. So don't go with that. Since there is a bilateral code, always use that code only. So ICD code we got as H40.1131. Now let's find out what is the CPT code. So open the CPT code book. Again, this is medicine chapter 90,000 series. So what is first CPT? 92002. I am going with option A now. Okay, 92002. So here now what are the procedure that you have to code? Comprehensive medical examination, fundus photography, as well as extended visual field examination. Okay, what is 92002? Ophthalmological services, medical examination and evaluation with initiation of diagnostic and treatment program, intermediate, new patient. This is intermediate. Yeah, this is a new patient. Intermediate. This is not comprehensive. So you don't have to go for the other codes. Okay. So go to option D. What is 92004? First you can find out this comprehensive code. Then you can go with the other code. So comprehensive medical eye examination. Yes, 92004 is comprehensive. Same ophthalmological services, medical examination and evaluation with initiation of diagnostic and treatment program, comprehensive, one or more visit. New patient, comprehensive So this is the comprehensive code that you need, 92004. Now anyway, you got the answer, right? Still, let's look into the other codes. And the second service that you need to code is 92250, which is fundus photography with interpretational report. With interpretational report is also mentioned in the question. So 92250 is fundus photography. And what is 92083? In option D, 92083. Again, you have to code for the, what is the third procedure? Extended visual field examination, right? So 92083 is visual field examination, unilateral or bilateral with interpretation and report, extended examination. Yes, this is extended examination. The third service, which is mentioned in our second, third line in the question. Extended visual field examination. So instead of that, you might be getting some other name also. See in the bracket. Extended examination. Example, Goldman visual field with at least 3 isopters, plotted and static determination, etc. Or quantitative automated threshold perimetry, octopus program G1 32 or 42, Humphrey visual field analyzer. So any of these name can also be given in the question. Instead of extended visual field, you might be getting names like this. Okay, like octopus program, something like that. So that is why I'm telling you, always you have to read what is mentioned in the bracket in the CPT code book. In each and every code, you have to always read what is mentioned in the bracket. You will be getting some answers from that. And then whatever is mentioned below on the description, there will be sometimes bracket. There will be sometimes something is mentioned like you don't have to code this code along with that code. You don't have to put modifier. All these things, blah, blah. Okay, everything will be there. So you have to always read out whatever is mentioned in the bracket. Okay, don't forget that. So here, since this is extended field examination, the correct code will be 92083. So here also our correct answer is option D, 92004 for the first procedure, comprehensive medical examination, 92250 for fundus photography, and 92083 for the extended visual field examination, along with the diagnosis of bilateral open angle glaucoma, primary open angle glaucoma, mild stage, bilateral, that is H40.1131. Okay, so option D. Now moving to the fourth question. A 4-year-old critically ill child is seen in the emergency department with respiratory failure due to aspiration from falling into a swimming pool. A bystander on the scene provided CPR and the child is breathing on his own but is non-responsive. The emergency department physician called the PICU, that is pediatric ICU. Okay, we called the PICU pediatrician to see the child and take over the care. The PICU pediatrician intubated the child and mechanical ventilation was started. The pediatrician admits the patient in PICU and continues the care of the patient in PICU. 20 minutes of critical care time was performed by the PICU pediatrician. How will you report the PICU pediatrician services? So here PICU code you have to, PICU pediatrician services, you have to code it here. So you know that this is an E&M code, right? Even critical care codes, everything belongs to E&M. So you can go to the E&M chapter. We can directly find out what is the E&M code here. What is 99? What is the first option? 99475. 99475. Initial inpatient pediatric critical care. Yes, this is pediatric critical care inpatient service, because here it's mentioned that pediatrician has admitted the patient in PICU. Anyway, PICU means it's an inpatient only. So, initial inpatient pediatric critical care per day for the evaluation and management of a critically ill infant or young child 2 through 5 years old, of 5 years of age. Yes, this is 4 years. So, this belongs to this category. So, initial pediatric care. 99475 code represents initial pediatric PICU care. Yeah, this is initial, starting only, the initial pediatric care. So this can be the code. Now let's check the other codes as well. What is 99? What is 99285? As in the option B, 99285 is emergency department visit. Since emergency department, the patient has seen in the emergency department, but the question belongs to the PICU pediatrician service. So you have to skip this one. They didn't ask for any emergency codes. They had asked for only for the services provided by the PICU pediatrician. So you can't mark this code 99285. Similarly, what is 99291 in option C? Critical care E&M code. This is critical care E&M code for the critically injured patient first 30 to 74 minutes. This is not a PICU code. This is critical care code for the first 30 to 74 minutes. Okay, no need to go for the time because anyway, for us time is mentioned 20 minutes. So don't be confused that since time is mentioned in the question, you have to code with this one. No, that is wrong. Even though the time is mentioned 20 minutes, whatever it is, it doesn't matter. This is a critical care patient. This is not a, since in the question, we have directly mentioned that it is a PICU patient. So since we have a direct PICU code, don't go for this one. So even option C is also wrong. So option D, again, same 99475 as we had find out initially. What is 99475? Initial inpatient pediatric critical care. Yes, that is the right code. And it's mentioned, marked it with modifier 25. What is modifier 25? And then another code is also there, one more code. That also we will find out. Modifier 25 is significant separately identifiable E&M service by the same physician or other qualified healthcare professional on the same day of procedure or service. Yes, that is also required. Same day of procedure, you have to mark the with modifier 25 because it's separately identifiable E&M service. Anyway, let's find out what is 31500. So you have to go for 31500. What is 31500 code? Go for 31500 because here along with the PICU service, what other service the doctor has performed here? The pediatrician, it is mentioned, yeah, the PICU pediatrician intubated the child and mechanical ventilation was started. So intubation is carried out here. Then the pediatrician admits the patient in PICU and gives the care, continuous care of the patient. So PICU admission as well as intubation, because the pediatrician has given the intubated the patient. So it means you have to code for the intubation as well. So the what is 31500? Yes, intubation endotracheal emergency procedure. Yeah, so that is the intubation code. So you have to go for the intubation code as well. That's why intubation is done. Then the pediatrician has admitted the patient in PICU, which is also a separate procedure, but it is done by the same physician itself. So that's why we are appending the T&M code with modifier 25. Okay. So don't be confused with options A and D. Here both the procedures are carried out by the same procedure, by the same physician. So you have to mark the E&M service with 25 modifier. So the answer here is option D, 99475 with modifier 25, and then the intubation code 31500. Okay. Now let's look into one more question. Fifth question. A patient is referred to the hospital radiology clinic for numbness and tingling in the left arm. The physician suspects it is related to thoracic outlet syndrome. So this is just a suspect. Okay, thoracic outlet syndrome. The radiologist performs a bidirectional Doppler waveform analysis and a volume plethysmography at 2 levels in the left arm. A duplex scan of the left arm is also performed. So duplex scan also you have to code out. What CPT codes are reported for the professional services for the encounter? So here, what is that? Doppler. What procedure is done here by the radiologist? The radiologist performs a bidirectional Doppler waveform. So that is one procedure. Okay, you have to code for bidirectional Doppler waveform analysis and volume plethysmography. All this you have to code, and then a duplex scan. So all this you have to, all these answers should be there included in your code. So let's find out what are the options, what is the correct option. Okay, what's the first code? 93922. 93922. What is 93922? Limited bilateral non-invasive. This is again belongs to the medicine chapter, 90,000 series. Okay, extremity arterial studies including digits. So limited 93922 represents limited bilateral non-invasive physiologic studies of upper or lower extremity arteries. Example, for lower extremity, ankle, brachial indices or distal posterior, tibial and anterior, tibial dorsalis pedis. Here in the question, for us it is numbness and tingling in the left arm, left side. So left arm, it is upper extremity. Studies of upper or lower extremity. Yes, both are mentioned, upper or lower extremity. So you can go with this code, upper or lower. Since left arm belongs to the upper extremity, you can go with this code 939922. Okay, and what is just skip out this modifier. I will tell you what modifier it is. Now, what is 93930? 93930. 93930 is duplex scan. Again, you have to code for duplex scan 93930. Duplex scan of upper extremity arteries or arterial bypass graft. Complete bilateral study. Is this a complete bilateral study? Or what is 93931 code? Just down. Unilateral or limited study. Duplex scan of unilateral. Here it is only unilateral, right? Because only left arm. Duplex scan of left arm is performed. So this is not a complete bilateral study. This is only a unilateral study. So you have to go for the code 93931 for the duplex scan. See, like that, if you can sort out what is the correct code, you can easily find out the answer, the option. Because 93931 code is there only in option D. So options A, B, C you can skip directly. 93931 duplex scan of left arm is performed. So you have to code only for the duplex scan of left arm, which is 93931. So you got the, you directly got the answer, right, as option D. So what is option D? We can now skip out other options because 93931 is not there in other options. So 93922 option is limited bilateral, same, the one that I had told you earlier. Limited bilateral. This is limited only, not complete, because only left arm, only upper extremity is performed. So 93922 is limited bilateral non-invasive physiological study of upper extremity. And then it is appended with the modifiers 52 and 26. 26 is professional component. It is already mentioned that this is a professional component. You have to code for the professional component services. And what is modifier 52? Partial reduction or discontinuation of radiology procedure and other services that do not require anesthesia. Okay, partial reduction or discontinuation of radiology procedure. Yeah, partial discontinuation of radiology procedure, then the duplex scan is performed. And there is no anesthesia performed. Yeah, so that is true. So 93922 procedure in your code, you have to mark with modifiers 52 and 26, and then 93931, that is duplex scan, mark it with modifier 26 to represent that this is a professional service. Anyway, in the question it is asked for the professional service. So here the correct answer is option D is mentioned. Okay. So friends, these are few important questions. Hope you like this video. If you have any doubts or any queries, you can ask me. You can mark it in the comments and I'll be getting back to you as soon as possible. So please support me, friends. If you are new to the channel, please like and share. Please subscribe if you are new. And thank you so much for your support. So stay tuned for more videos, more chapters. I'll be coming back with more and more important chapters, important topics, okay, for the examination, and along with some examples, practice questions, mock questions, everything. So till that, stay tuned for more. Stay tuned, friends. Thank you so much for your support. Bye. Take care.